in Cambridge for over 20 years. I've worked in New Zealand, I've worked a bit in Thailand as well. Yes, I've got a master's, so I'm a little bit of academic, but I'm not really. And I moved up to Cheshire 2 years ago with my family, and I now currently work as an interim for Manchester Mental Health Trust. So why did they ask me? I mean, I don't in some ways really know, other than the fact that I have been a recovery lead in both those organisations and have a little bit of a practical understanding of implementing different strategies of trying to work with organisations about how to drive forward change in becoming more recovery-led. And I think that's really what you're trying to think about here. And so that's what I'm hoping to be able to talk about. Some of what I'm going to talk about has already been covered by Julie in terms of things like, and there's about HR and things like that. But I'm going to talk about organisational commitment, a bit about service delivery, stuff on transforming the workforce, which you've already talked about, we've just heard about, and partnership working. So you need to be able to work with almost every organisation at every single level on a whole range of different things. I mean, Inrock's divided it up into 10 challenges, but each of those 10 challenges has themselves got substrata to them. So you've got to work across a very broad remit. So you need, I mean, I'm kind of the, you sound like a lone person, but actually, and I'm sure Julie would agree, what your role is really a lot about PR, it's a lot about getting people on board, it's a lot about getting, driving forward change to growth of understanding. So you do need to have masses and masses of conversations, as well as coming up with strategies. Now, both the organisations I worked in ran programme boards or project boards, and underneath them they had workstream meetings or workstream groups. And by and large they fell into those 4 areas about organisational commitment, service delivery, HR working, transforming the workforce, and partnership working. So those 4 areas are therefore then responsible for focusing some of the work that needs to be done and the work reporting back to those groups. So some of the things you might want to do are around, I mean, things that I've done in both organisations is trying to develop an organisational understanding and using the notion of a recovery pledge to do that. So through a process of consultation and co-production, developing a set of statements that the organisation can then start to think about what does recovery mean to us as an organisation, and what does every member of staff need to understand and be able to articulate their role in being able to do. Now in Manchester what we're trying to do is with that pledge, it's not been launched yet, it's been consulted on, the statements have been agreed, and those set of statements were then sent to our arts, one of our arts projects, and they developed some images to go with them. So we now need to go through a launch process, but one of the areas that the consultation identified was how are you going to know whether you're delivering on that pledge. So we're trying to build that in, and this is where it links with things like HR and learning and development. Those pledge statements will be sitting within appraisals, so every member of staff will be asked to articulate how they've seen themselves as delivering those pledges in the previous working year. They'll sit in the value-based practice work that HR are currently doing from the point of view of looking for a job to work in the trust through recruitment, selection and appointment. There'll be value-based work streams that HR will be asking people to undertake, and those pledges will sit and to inform some of those. We're also going to be actively asking people who use the services to tell us if we fall short of delivering those pledges in any shape or form, and then we can therefore build on that and go back and look at why that happened. Interestingly, one of the notions about the pledge that people had most difficulty with was the notion of hope. I got a number of comments back about how can you possibly have hope on a pledge because we can't demonstrate when we've done it. My answer was we can certainly demonstrate when we haven't done it. So even if you think you can't measure hope in terms of a success, you can measure it where we've absolutely removed it or made it very difficult for people to see that. But interesting, that's one of the major components of recovery is this sense of hope. And yet consistently I got these messages about saying hope should really be in there, which is a very, it just shows you where the organisation is at, I guess. One of the other things we tried to do was look at a tool that would help us to understand where teams were at and where organisations were at, and so the team themselves can reflect on where their notion of recovery is. And so that's the tool. There are a number of tools around, but the best one is Julie's, of course. And what it's done, I mean, I think I've tried to implement that in Manchester, and it's taken a long time, and I think you'll probably hear the message from lots of people saying it takes time. But a year after me trying to get it rolled out, I've got teams still phoning me saying that'd be fantastic if you come and help me do it, but it's been very, very slow to get people on board. And I think you need to bear in mind when you're trying to implement recovery-led strategies is that the organisation and the staff and the teams within it are all going through all sorts of other stuff, as well as you trying to come along with this fantastic way of working, a new way of doing things. There's been lots of austerity measures around different organisations that people have had to go through transformations. Certainly where I am now, people are losing jobs or jobs are changing. So their headspace is elsewhere. So you need to kind of push where you can. Don't move where things will give. There are other strategies about things like incorporating recovery into corporate induction. It sounds like a very simple thing, but if you can get people when they're starting in the organisation to talk about the notion of recovery, and people have been very enthused by that 20-minute slot of just saying this is what the organisation is all about. We've got things that to try and inform staff and to inform people from outside as well, so developing web pages and looking at things like recovery education development. And one of the things where I am currently is not to have a risk strategy, but they wanted a risk register, which meant the organisation is accountable for the things that we say we're going to do. So in a way, and that goes right up to the trust board, if we're not doing it, then we need to know why. So there are lots of things in service delivery that tie in with that organisational commitment. So if there are service reviews going on, if your organisation is going through any sort of form of service transformation or change, then be in there. Be there with them, to walking the journey. Where I am currently, they've done quite a lot of community services review, which I know is not unfamiliar with different organisations, but they've recognised that recovery is something people need to learn more about, because it will support them to help manage things like very big caseloads, and look at why they've got such big caseloads and what perhaps they could do about that differently, viewing the people they've got on their caseloads differently, working with them differently. And obviously then starting to expose the notion of things like what could we do that would help that, peers obviously being one of them. The TRIP, which is the Team Recovery Implementation Plan, is something that the teams that have done it have really valued it, and it's made them really reflect on what they're doing and what they could do differently and how that might impact on the work that they do. Recovery learning has been a consistent theme throughout, because every time someone does a TRIP, they have to think about what they could do differently, and they're saying, well, I think we need to know more about recovery. And what's very interesting, that although recovery has been talked about for many years now, people still don't feel they really truly understand it. So they're all asking for learning. They have reviewed things like the clinical risk training, which in itself is quite simple, but there's a lot more to do on risk, and try to address things like the risk practices that staff undertake, the notion of sharing a risk assessment or talking to someone about what their issues around safety and risk are, that is still very alien to staff predominantly. We piloted some modular learning on recovery as part of the developing a learning notion around learning, because the learning is not just about developing specific learning, it's about looking at all learning that's going on in an organisation and how recovery is linked and embedded within it. So even control and restraint training, for example, breakaway techniques, all of those things could have recovery in them. So even if it's, I mean, maybe not, infection control. So there are some things that clearly are just, basically about that topic. But there are almost every other topic in mental health you could embed recovery in it and say, how could you do it differently that might influence things? So if you talked about control and restraint, for example, thinking about advanced directives, how it links with that. If you had to use control and restraint with someone after the event, how do you manage it? How do you manage during the event? We had a peer when I was in Cambridge. They had a debate about should peers be involved in control and restraint or not. And one peer said, I want to be, because I've seen them do it wrong and I want them to do it better. So they were there and they helped engage the person, because the staff beforehand had thought you could not engage with the individual during the period of control and restraint. And the peer demonstrated that that could be done completely differently. So that was then introduced into recovery-led training within control and restraint, so that you can almost look at everything you do and try and make sure that there is that golden thread that's running through. Okay, so recovery education development and experts by experienced tutors, that's a massive topic in one bullet line. I'm going to talk a little bit about it in a couple of slides. But it really throws on its head the notion of how we deliver services, that professional expert leading and delivering and telling someone what to do, as opposed to that kind of co-production working in partnership, demonstrating that there is learning to be learned from people who've experienced mental health challenges, but also that they can deliver services in partnership with us.